So, sir, what has inspired you to become an embryologist basically, sir?
My bachelor's was on zoology, where we deal with all the like all the animals, embryos, like chick embryos and everything. So I was thinking that it is very limited to only IVF is only limited to animals, because whenever something comes into market, so it will only be limited to animals, and translating to a human it takes time. I was not aware of that human all IVF also exists. So during my masters, I came to know that I have done my masters in clinical embryology and as well as biotechnology. So during that time, I got to know that there is something exist of human ART also where we can pursue. And I was also thinking that it could be in abroad, but not in India. So while my master's journey has begun, so I got to know that there is something we can do as a service oriented, where we are impacting the patient's life with giving the with from a couple to become a family. That having a bridge in between, that is what gives us a pleasure. So I thought that this is the right field that I have to choose. So I have just got on board.
So, how do you feel working as an embryologist, sir?
I can't express you in the words, but it is exhilarating experience that working as an embryologist.
So, what is the role of an embryologist in this IVF process, sir?
IVF process, like as I have earlier told you, that we deal with gametes. Consider in a natural cycle, a woman ovulates one egg per month. So in IVF, what doctor does is they stimulate the patient to produce more eggs, more mature eggs. So till the stimulation part the doctor does. After that, what we do is the doctors will collect the egg and they will hand it over to us. There we will screen the oocytes from the blood. We take it, we wash it. There will be another cells also called cumulus oocyte. The other cells surrounded by oocytes. So we will trim all. We will only pick oocytes. Then fertilizing them either through IVF or ICSI. IVF is something like in a normal conception, what happens? The conception happens inside the body. We don't know what happens. So if you are doing it outside, it is something like in vitro fertilization. That is what we call IVF. So we let the sperm go and meet the egg, and if that fertilized, the further sequence will happen day 2, day 3, day 4, day 5. So it will form a blast and we will transfer it. If not, there will be patients that will be having less count or less motility, or there could be other implications from the male partner that requires a procedure called ICSI, that is intracytoplasmic sperm injection. So what it does is we make sure we take a healthy normal morphological sperm through that process with higher magnification. So we pick that and we fertilize that with the egg. We basically inject the egg. So fertilization is something like meeting two DNA, making one. In a female there is a 23 pairs of chromosome. In male there is a 23 pairs of chromosome. So that is called haploid cells. So we make them fuse together. By combining that, it forms a 46 pairs of chromosome. Thereby it initiates a process of having a new individual, that is a half from mother and a half from father. So it leads to a different individual, that is what we call as embryo. One embryo is in one individual or one baby. So we culture them, we nurture them, and we transfer it.